I did diabetes and how that affects family health, and I am Sydney Snyder. So, this is diabetes and how it affects family health. So, in the affective domain, a family member with diabetes should not have a large impact on the way the family loves each other and makes each other feel like they belong, but at times it could. So, here's an example. If in a family that has more than one child, if a child has diabetes, parents may spend more time with that particular child, helping them with insulin, making sure their diet is healthy, helping them test their blood sugar, really anything. And this could cause jealousy in the other siblings and may cause them to feel as if they don't belong. In the economic domain, diabetes is a costly disease. If not diet controlled, families must pay for medications, insulin syringes, glucometers, glucometer strips, and lancets. According to the American Diabetes Association in 2013, individuals with diabetes spend an average of $13,700 a year, and $7,900 of that is due to diabetes. So this is 2 to 3 times more than if the person did not have diabetes. So for a family, if they are spending this much on an individual with diabetes, it may decrease the amount of money they have to spend on other things for the family. So whether it be fun activities like family vacations or necessities like food. In the socialization domain, according to Kakian, Coelho, Steele, Tobacco, Hansen, 2015, the socialization aspect of family functioning includes a family's ability to protect each other, allow interdependence between members, group interaction, and mutual support for each other. So, a family member with diabetes, especially if it's a child, but it doesn't have to be a child, may be totally dependent on another family member, and this could cause caregiver burden and coping issues because the family member that's caring for them is not getting that interdependence. In the healthcare domain, according to Kakian, Coelho, Steele, Tobacco, and Hansen, 2015, health promotion practices, well-being, maintenance of a disease, and care of a member during sickness are impacted by family. If a family does not value health, the member who has diabetes is probably not going to take care of themselves and manage their diabetes because they're not going to value their health either, because you're influenced by your family. But families could also be a huge support and encourage diabetic members to seek health care and to stick to care regimens and diet and exercise. In the reproductive domain, family history of diabetes leads to a higher risk of developing type 2 diabetes, and that's according to the National Institute of Diabetes and Digestive and Kidney Disease. So, parents may be hesitant to start a family, knowing their kids are more at risk for type 2 diabetes because it does run in families. Diabetes in a woman could cause issues with pregnancy. According to the American Diabetes Association in 2013, uncontrolled glucose levels during pregnancy can cause pregnancy risks and birth defects and may increase the risk of miscarriage. And this may make a couple hesitant to start a family. And if this couple does not manage their diabetes appropriately while pregnant, they are at risk for losing their baby, and that would obviously cause tons of emotional distress on the family. And then I'm going to go over diabetes in Africa, and here are just some statistics. According to the International Diabetes Federation in 2015, at least 14 million people have diabetes in Africa. It's estimated to be 66.7% of these people in Africa with diabetes aren't diagnosed. And of the individuals who have died from diabetes, 79% were under 60 years old. I mean, that's a huge percentage. So this would have an effect on families because the death of a family member is going to affect a family in many different ways. And then Africa does not spend as much money on diabetes as the United States does. Africa spends about $3.4 million, and in 2012, the U.S. spent $245 billion on diabetes. So if a society is not spending as much money on managing diabetes, then families will have difficulty managing their disease because they don't have the resources to manage it. Families will deal with comorbidities of the disease and stress it brings to family relationships and functioning. So then these are just some initiatives in Africa to help with diabetics. The International Diabetes Federation created the Diabetes Africa Foot Initiative, which allows affordable foot assessments in Africa to prevent amputations due to diabetes. And then they also created the Global Diabetes Plan, which provides an outline to help societies improve health for those with diabetes. Helps with diabetes prevention and prevention of discrimination for those with diabetes. And then they also created the International Charter of Rights and Responsibilities of People with Diabetes. This discusses how diabetics have the right to health care, education, and social justice, but they have a duty to care for themselves as well, and it protects the rights of those with diabetes. So these are just some community sources around us for those with diabetes. So Diabetes Dayton is a nonprofit company that offers diabetic education sessions, screenings, and diabetes emergency supply assistance program, and that is for those who aren't insured, and referrals to help. They also offer summer camps for kids with diabetes and a yearly diabetes expo. So this is very supportive for families. It offers the educational sessions so all members of the family could attend, and this could help them to learn about the disease and learn how to support their family member with the disease. Offering summer camps for kids with diabetes would allow children in a family to meet with others with their condition. And then it helps out with families with economic issues by offering diabetes emergency supply assistance program. So this could help the economic issues of the family if the family can't afford food or afford necessities. Premier Health in Dayton offers diabetic education classes. Kettering Health Network offers dietetics counseling and support groups for those with diabetes. Dayton Children's offers support groups and educational sessions for children and families that have children with diabetes. And these would be somewhat helpful for families. I think the education sessions for parents with children with diabetes would help with them understanding the disease and help manage it and how to support their child emotionally. And then this is just social policy that affects those with diabetes. So the Affordable Care Act made some changes that affects those with diabetes. So this is according to the National Conference of State Legislature in 2011. So it does not allow the insurance companies to reject coverage for kids with pre-existing conditions like diabetes. It also created the Pre-Existing Condition Insurance Plan, and this helps with insurance coverage for those individuals who had difficulty finding insurance due to their diabetes. Insurance companies cannot reject coverage due to pre-existing illness or let go of insurance for an individual due to a new diagnosis like diabetes. This will allow families to afford insurance and be able to receive the diabetic management and care they need. The Affordable Care Act, according to the National Conference of State Legislature in 2011, also mandated that facilities who accept Medicaid will be offered incentives to decrease tobacco use, decrease weight and cholesterol, better the management of diabetes, and decrease comorbidities of it. So that's going to be an incentive to make them adhere to these. It created the Prevention and Public Health Fund that created money for health promotion and prevention interventions to reduce manage chronic diseases like diabetes, and it approved the National Diabetes Prevention Program, and this allows grants for communities to initiate prevention programs for diabetes. These prevention strategies would be helpful for families because it would help with management of the member with diabetes, but also prevention for other members who don't have the disease, but they could be at risk. And then these are just health promotion strategies for someone with diabetes or family with a member with diabetes. According to Campbell 2003, family psychoeducation can be used to help with the whole family cope with chronic disease and to help with family relationships and family functioning. According to Chesla 2010, family relationship interventions will be necessary. Family relationship interventions improve family coping, skills and communication among each other to handle the chronic disease and treatment of it. According to Big, Benitez, Quinn, and Burnett in 2015, a systematic review was conducted on diabetes and family interventions and found, including the family in educational sessions and educating on handling stress and getting family on board with nutrition, exercise, and encouraging family support can improve psychosocial outcomes and understanding of diabetes as well as self-care. So for my intervention, I'm going to have family educational sessions and family therapy to encourage communication, coping, and involvement in nutrition and exercise. And then these are just some cultural implications. So diet and exercise beliefs of a culture would have a huge impact on caring for someone with diabetes. So according to Heisler in 2017, culture and values play a role in diabetic promotional behavior like healthy diet and exercise. So a nurse may have difficulty having a patient and family adhere to a healthy diet, like a low carbohydrate diet, and exercise regimen if their culture doesn't typically practice these behaviors. And then according to Heisler in 2017, this is another example, Latino patients value family, faith, and religion, so providers need to take this into consideration when providing care as well as providing language-appropriate education. And then according to Heisler in 2017, individuals are more likely to engage in health care when education is appropriate for them in their native language. And then here are my discussion questions. What are some ways as an APRN you could overcome cultural issues when managing a family with diabetes? And then the second one is, in caring for a patient with diabetes, have you noticed the effects it has on the family, and what were the effects? And then here are my references.